as they want. Give it another 1 minute here. So I'm Jackie Gibson. I'm the Vice President of Marketing and Business Development at Pillars Community Health. I'm joined on screen here by Ana Padron-Sikora, our VP of Community Engagement, who will be translating for us today, as well as Lisa Wanafried from the Berwin Historical Society. We have Spanish interpretation available. If you want to listen to the Spanish version, just wait 1 moment, I'll turn it on. You'll have the option to click interpretation in your Zoom screen and select Spanish. Anna, let me turn that on for you. Okay, Anna, you want to give it a test? Perfect. Okay, hi June, thank you for joining us. We're just getting started. I'm Jackie Gibson with Pillars Community Health. Ana Padron-Sikora is translating for us. If you have an interest in switching to Spanish, you can click interpretation in your screen. So Pillars Community Health is 100 years old this year. Happy birthday, us. We date back to 1921 in downtown LaGrange and 1928 in Berwyn. And I'm gonna go ahead and share my screen so we can start looking through some fun pictures here. Before we start, just a little overview about our organization in present day. So we offer medical and dental services, mental health and substance use disorder services, domestic and sexual violence services, and community outreach and prevention education in all of those lines of service. Today we have 9 locations. We'll talk about some of those today. This includes 2 locations in Berwyn. And all of our services are provided regardless of your income or insurance. In fact, several of our services are available at no cost, and that includes our domestic and sexual violence services, as well as Buddy's Place, our childhood bereavement program. You can reach us at 708 Pillars, and our website is pillarscommunityhealth.org. Okay. I'm gonna go ahead and give the mic over to Miss Lisa here from the Berwin Historical Society that is partnering with us for this presentation today.
Hello, everyone. As Jackie said, my name is Lisa Wanafried. I am the president of the board of directors here at the Berwin Historical Society, if you don't know me. We are incredibly excited to be a part of this today. Obviously, 2020 taught us just how very important our community health centers are for us and just how very integrated they can be in our community. So we are very excited to see how the history looks through the eyes of Pillars today. We are currently working on several things, most of which will be available in the summer because of obvious health reasons. So we will be doing things like a garden walk this summer. We are also looking to we are definitely working on having a video out on our different housing types later this year. We have a young man working on it right now. And we are excited about everything else we can bring you, and definitely very excited about hearing from Jackie. So I'm going to toss it back over to you.
Thank you, Lisa. All right. We had a couple people just join us. Thank you, Diane and Cheryl, for being here. If you're interested in viewing this presentation in Spanish, you can click interpretation at the bottom of your screen and you'll hear Ana Padron-Sikora translating into Spanish. So launching in, I have been fortunate enough to spend the last few months digging through this organization's historical archives, and there is a lot. This dates back to World War I and is inclusive of everything from newspaper articles, like you see here, board meeting minutes, photos, slides, handwritten notes, the whole gamut. Now I only have an hour today, so I'm going to try to keep it brief. But this is a little difficult because we actually are the result of about 8 organizations merging together over the years. So I'm going to most heavily focus today on the second one here, Berwyn Family Services, which later renamed in the 80s as the Fillmore Center for Human Services. We still have that location. Um, and the bulk of the presentation will be in the 1970s and 1980s. That's when the work of Fillmore really picks up and we start to just have more and more stuff in our historical archives. If you're interested in learning about some of these other organizations, for those of you who registered, I will email you next week with a link to our LaGrange presentation, which we did Thursday night, which highlights community nurse and some of these mental health associations that sprang up in LaGrange. And we'll also send a link to a full booklet download of our entire 100-year history, which we're finalizing now. But before we do that, let's go to 1921. So I'm going to start in LaGrange. You will see me periodically talk about towns other than Berwyn, just so you can understand how this organization got to where it is today. So put yourself actually in 1919 first. It's the end of World War I. Women just got the right to vote. The Spanish flu epidemic is in full swing. Here we go, right? Another epidemic. And the Women's Club in LaGrange was doing some post-war volunteer efforts and decided to focus those efforts on children's health. So what they did is they formed a local chapter of the Illinois Child Welfare League. We're going to just refer to them now as the committee or the Women's Club. They're the ones kind of behind the scenes fundraising at this time and trying to launch new efforts. This committee invites a representative from the state to come talk to LaGrange about the possibility of hiring two things, a community nurse and a school nurse. Now, at this time, it wasn't commonplace to have a school nurse. So this really was a new thing for the area. And they did hire a school nurse for Lyons Township as a direct result of that meeting. And then shortly after in 1921, our first paid community nurse, she's on the left here, Marion Jean McLeod. She's assisted on the right by Mrs. Georgia Schwab. They begin providing well baby checkups from the back of a pharmacy in LaGrange. And that's really where our history begins. This would become known as Community Nurse Health Association. And that organization would last until our most recent merger in 2018. Their health center is now part of Pillars Community Health. So we really can't talk about Pillars Community Health and even Berwyn history without also acknowledging what was going on in LaGrange at this time. I put the link here for our YouTube if you're interested in watching that LaGrange presentation before I send the link. The YouTube link is here. But let's talk about Berwyn. So the economy is booming in the 1920s, right? This is the flapper era. So families have more money to spend on healthcare than they ever have before. And as a result of that, there's a demand for hospital services. And before that, the folks would, get care in their homes. But as they had more money to spend, they began to seek out hospital services. That led to the mass accreditation of hospitals across the country, including McNeil Hospital in Berwyn, which just turned 100 last year. But what happens is a supply and demand thing, right? So more and more people are demanding these expensive hospital services, and that prices a lot of people out of getting access to quality care. So as a result, national and local service organizations are formed to address the needs of lower income families. Now I'm going to talk a little bit about what Berwyn was like at this time, right? It's a fast growing new suburb in the 1920s. Farms and open fields were being transformed into neighborhoods of 2 flats and of course bungalows. By 1928, the town had grown from a small village of Victorian homes near a railroad line to a bustling town of 47,000 people. Just one moment. Okay. Now by 1928, when Berwyn Family Services starts, The town had grown from a small village of Victorian homes near a railroad line to this bustling town of 47,000, right? And many of the newcomers are immigrants from Eastern Europe whose hard work would develop the banks and businesses along Cermak. But for other residents, life posed challenges, right? And we talked about being priced out of a lot of things at this time. So Berwyn launches its health department in 1920. Today, that's known as the Berwyn Public Health District. Health department employee David Abram suggested, hey, we should do something. We're seeing more and more Berwyn families requesting welfare dollars. And, I think we can do better than just welfare checks. We can also come around them with wraparound services. So the Berwyn Welfare Association was born on May 20th, 1928, with funding from the local community chest and private donations. Their work included helping Berwyn residents get milk at a cheaper price, 9 cents instead of 11 cents, and purchasing lots for community gardens so these low-income families could grow their own food. So I want to show you a little bit about David Abram. This is really all we really know about him, but he was actually born in England, in Wales, and passed away in Berwyn in 1943. All right. Just 1 second. I'm so sorry. All right. Children are part of this presentation too. All right, we're going to go on to this early document. This is from the late 1920s. And this shows that the purpose of the organization was really to rehabilitate disrupted families, perform this welfare work, and also provide emergency relief. And you'll see that phrase like emergency relief come back again during the Great Depression in just a couple slides. And then listed here at the bottom are some of the early board of directors from the Berwyn area. Okay. So let's go to the 1930s now. We're in the Great Depression. The federal government begins distributing financial assistance through local welfare organizations. And this includes the Berwyn Welfare Association. So at this time during the Great Depression, they're serving about 1,000 families. And with the country later at war, they begin to be allowed to, they get authorized to clear emergency furloughs for the Red Cross. What that means is, and if an employee in the Berwyn area is furloughed from their job, Berwyn Welfare Association is authorized to step in and provide emergency financial aid to that family. The organization also formed a women's auxiliary at this time to raise funds to continue operations. We actually see this across all of our legacy organizations, that women play such an enormous part in fundraising to keep all of these organizations open. And that women's auxiliary for Berwyn Welfare Association actually opened a thrift shop called the Piggy Bank. I don't have a picture of the piggy bank. I so wish I did, but they were open in Berwyn around the 1940s. Now you'll see here in this image, they were paying physicians at this time to make house calls in Berwyn for $1.50 per house call. And really, this is all I have photo-wise from the 30s and 40s. And we can only speculate as to whether the backdrop of the Great Depression and the beginning of World War II have anything to do with that. The same thing kind of happens with our LaGrange predecessors around this time. At Community Nurse, we have a lot of newspaper clippings that really show the desperation and the poverty of this era, but we don't see a lot of photos. And I think everybody's just kind of trying to hang on and survive through this period. So let's jump forward to the 1950s. The 1950s bring a post-war boom, of course, we all know, in America, and the introduction of the civil rights movement. And as part of that, we get a bunch of other outcroppings, which we'll talk about. And one of the outcroppings of the civil rights movement is a national policy called deinstitutionalization. Have fun translating that on. That's a big word. So deinstitutionalization is a reaction to and against the abuses of state-run mental health institutions, sometimes called asylums, right? That policy called for moving people with severe mental illness out of asylums and back into the community. And the way they said we can do this is if we come behind those folks with community-based mental health services where they can get their care in the community and new medications to help them be able to kind of go about their everyday life in society. Also at this time, we get like Social Security, vocational rehab laws, and this really frees up locally. There's more money available for things like welfare and vocational rehab. And so the Berwyn Welfare Association decides, well, that's not really the need anymore because that need is being taken care of. What's needed now is to address this deinstitutionalization policy. So as we see so many times in our history, the organization says, let's stop, reassess, and do what the community most needs. So they changed their name at this time to Berwyn Family Services and begin focusing on casework, mental health counseling, psychiatry, and emergency assistance. This is so true of who we are today, right? 2020 hits, everybody goes remote, shelters in place. And we said, it sounds like the need right now is COVID-19 testing. We're going to do it. And we opened 3 COVID-19 testing sites, which remain open today in Burridge, Burbank, and Stickney. Burridge, Burbank, and LaGrange. So at the same time that Berwyn shifts its focus to mental health, 2 mental health organizations pop up in the 50s in LaGrange on the same street as Community Nurse. These would later merge to become what we call Community Family Services. And I mention this because they're going to come back around and really impact Berwyn here a couple decades later. So now we've got Community Nurse doing community nursing in LaGrange. We've got Community Family Services doing mental health in LaGrange. And we've got Berwyn, now called Berwyn Family Services, switching its focus to mental health and psychiatry. And this is, I love this. I'm going to read this. This was found among our board notes. They were jotting down notes of how they would talk about their new organization. Berwyn's a great place to live. It has maintained its position as a city of homes. People take pride in keeping their homes and apartments in good repair. They take pride in their families. Cleanliness and neatness are universal qualities. Fine schools, parents participating, but misfortune can strike the home. To help at such a time is the purpose of Berwyn Family Services. We can't hope to furnish all the help needed, but we can and do help with the immediate emergency and aid in contacting proper agencies for this help they are organized to give. And I like at the very bottom, you see somebody hand wrote in, the major part of this work is counseling. So you see them again, like we'll help you with whatever is needed, but we're going to keep our focus right now on counseling. I'm leaving Berwyn again. So now we're in Summit. So now we've got these Community Family Services and Community Nurse in LaGrange. We've got Berwyn Family Services doing mental health in Berwyn, and a new organization's about to crop up in Summit. Sorry. And this is Des Plaines Valley Community Center. So what this building was called, this was on Archer Avenue in Summit in the 1960s. It was called the Teen Inn. It's basically a rec center, except the cool kids don't really think it's cool anymore and nobody's really using it. So the board that owns this building says, you know, there really is still a need for social services in the western suburbs, and we have a building. So what can we do? So they contact Whole House in downtown Chicago, and Whole House, you may know, was formed by Jane Addams in the 1800s. And Jane Addams had this phrase, I have a vacant building and a dream. Well, they're in sort of the same situation, right? They essentially have a vacant building and a dream to help people. So they contact Whole House and they say, hey, we know you guys have never had an affiliated community center in the suburbs, but what do you think about helping us out? Like there's clearly a need here. And Whole House agrees. So Des Plaines Valley Community Center, what we'll call DVCC, is formed. And they become the first Whole House affiliated community center in the country. Okay, Welcome to those who have joined us in just the last couple minutes. We are translating this presentation. If you click interpretation at the bottom of your screen, you can switch to Spanish. Upon launch, DVCC and Summit has one employee, Dr. Tom Jager, who's really overseeing like after school programming, things like that. Pretty quickly, he hires a second employee named Florence Borche, and they start the organization's Head Start program. Now that I tell you because this will pop up again for Berwyn Cicero a few years down the line. But ultimately, it starts at DVCC in the 1960s. Now, Head Start comes out of President Lyndon B. Johnson's War on Poverty from the 60s. So they recognized that Head Start was now something people, funding that you could get to pay for daycare services, and launched this Head Start program with 30 kids and a rented station wagon. All right, Berwyn Family Services, back to Berwyn, establishes new programming in this era, the 60s heading into the 1970s. And most notably is the Interpersonal Learning Center, what we'll call ILC. I know, we are an organization full of acronyms. Now, ILC is a part-time psychiatric rehabilitation pilot program. Pillars Community Health pilots all kinds of stuff over the course of its history. We're still piloting things today. Ultimately trying to follow best practices and help clients get the care they need when they need it. So what ILC is it's intended to help people with mental illness maintain employment while working on their social skills. So they initially launched at the Stickney Public Health District with all the staff coming from partnering agencies at that time. Now, new research suggests that one way to help clients prepare for continued employment is to work with them in their own client-run business. So ILC Enterprises is born. This psychiatric rehabilitation program turns into a client-run business. And what they do is they make wooden items that they sell, and clients are serving in various roles, office, support, or factory roles, and really learning how to run a business while working on their social skills and working on psychiatric rehabilitation. The program has such positive outcomes that the staff are invited to speak at a mental health symposium in Toronto in the mid 1980s about this program that they've piloted. So another thing we see coming out of this particular agency, piloting a lot of things and then really becoming known throughout Illinois, or at least the Chicagoland area, in this case, internationally, for this programming that it's launching, which is pretty cool. So I mentioned the Women's Auxiliary a bit ago. By this time, we're in the 1970s, they had grown to about 50 members, all women from Berwyn. And they held annual fundraisers every year. Illinois politician, you see her in the middle here, Judy Bar Topinka, became a regular MC at these luncheons. She pops up at all of our legacy organizations. So it wouldn't matter which town I'm covering. Judy Bar Topinka is with us in some capacity throughout this history. I'm going to stay in the 1970s a bit. Berwyn Family Services launches other programs at this time that spin off into modern day organizations that you probably know. So among these is Youth in Crisis, that is present day Youth Crossroads. They also helped found the Berwyn Cicero Council on Aging. And in 1978, they found a therapeutic daycare called Grant Works, which turns into the Children's Center of Cicero Berwyn. I told you Head Start was going to come back up, and this is where it comes back up. So in the 70s, we've got Head Start at Pillars Community Health under the organization DVCC and Summit. And then Berwyn Family Services helps launch what will become the Children's Center of Cicero Berwyn. Flash way forward for a second to 2015. Pillars Community Health was overseeing the Head Start grant for 18 area zip codes, and that included overseeing the efforts of Children's Center of Berwyn Cicero, which had its roots in Pillars Community Health. So we've really come full circle in a 40-year time span from working on Grant Works to, again, working with the Children's Center in partnership in the 2015 to 2020, which is pretty fun. And here you see just a typed up note from our executive director at the time, Ellen Quinn, talking about training sessions at Youth in Crisis, present day Youth Crossroads. This is Ellen Quinn. Sadly, that's the best photo that we have of her. Now, Quinn was known as a leader in mental health and a regular speaker in the Chicago area on social work issues in the 1970s. Today, the Community Behavioral Health Association, which is a consortium of community mental health organizations in Illinois, and Pillars Community Health is a member of that consortium, they give an annual Ellen Quinn Award. So we asked them, like, why do you give this award? Like, what can you tell us about her? Of course, there's some stuff here on the screen, sort of, has sort of survived the times. The consortium said she had been on their board of directors and was a clinician who was known for her commitment to the delivery of community behavioral health services. So it's just so fun when we find these kind of things of these. In LaGrange, we had Sophie Sloman, who was among the very first women practicing psychiatry in Chicagoland, and she was at one of our predecessor organizations. So it's really fun to find these notable names working at our predecessor organizations at this time. Okay, I'm actually going to flash forward. This is Community Family Services in LaGrange upon their merger in 1970. So again, just to round back, because this is going to come up later, I feel like I should give you a test. So there's Community Nurse in LaGrange, Community Family Services, which is these combined mental health agencies, Berwyn Family Services, primarily known for psychiatry and psychotherapy at this time, and DVCC and Summit, which has launched a Head Start program. Now, DVCC launches something else at this time. And again, I mention this because it is part of who we are at present day Pillars Community Health. They introduced Constance Morris House, which is our current day domestic violence shelter, presently at an undisclosed location in the western suburbs. Now, the 1970s are a decade of enormous growth for our organizations. And we saw it with the introduction of ILC, with the introduction of Head Start. For DVCC, it's the introduction of services to address the battered women's movement. The battered women's movement comes out of civil rights also, and also out of the women's lib movement. The first battered women's shelter opened in Urbana in 1971. And we see rape crisis centers opening nationally a year later in 1972. Today, Pillars Community Health has both a domestic violence shelter and we are a certified rape crisis center. Now, at this time, Brookfield police are noticing that there's more and more awareness of the battered women's movement and that they're getting more and more calls about domestic abuse. So they call DVCC and say, hey, what can we do? We want to partner with you to come up with a solution. So after months of advocacy, DVCC is able to zone a house in Brookfield in 1978. And by that time, there's about 250 shelters in America. Today, there are thousands of shelters across America. Later, that shelter in 1988 would move to its current undisclosed location in the western suburbs. We are one of the only domestic violence shelters in the western suburbs, and we have a 24-hour hotline, 708-485-5254, 24 hours a day for domestic violence services. And we'll talk more about sexual violence services in a bit. So everybody wants to know, right, who's Constance Morris? So this is a fun story to tell. This is her. So the executive director of DVCC at the time flies to New York City to meet with Constance Rothschild Morris Foundation. Now, Constance Rothschild Morris is the mother in this story. She is a philanthropist who has interests in things like immigration, people experiencing homelessness, and so on. She married Ira Morris, who's from Chicago, hence the link back to Chicagoland, right? Now, they raised their daughter, Constance Irene Morris, this is Constance Irene Morris, to concern herself with issues of people experiencing homelessness, domestic violence, and other issues. And they start this foundation and donate money to DVCC toward the opening of a domestic violence shelter at the time in Brookfield. And that is why the shelter, even today, is still named after Constance Morris. A portrait of Constance Irene Morris, their daughter, is in the Smithsonian Art Gallery in Washington, D.C. Unfortunately, there's no photo of that online. But a bronze bust of her is available for purchase from a private collection in London, if anyone's interested. Okay, another really important and interesting thing happens in 1969 that we really don't see impacting Berwyn Cicero until like 1979, 1981. And that is the Community Mental Health Act of 1969. It's called HB 708. Now, HB 708 is a federal government bill that says that local governments have the right to tax their citizens to pay for mental health services. But they don't have to tax their citizens, right? So at this time in the 70s, all of our legacy organizations, all of them, are spending all of their time raising awareness of the need for mental health services locally and advocating for passage of the 708 referendum. It works. And in the 1970s, things like the Lyons Township Mental Health Commission are formed, the Riverside Township Mental Health Commission are formed in order to have this referendum start taxing residents locally and then dole out funds to mental health organizations to address the community mental health needs. This also leads to the passage from Berwyn Family Services spent a lot of time advocating in Berwyn and Cicero, and the result was the passage of HB 708 in Berwyn and Cicero. Today, you know those as the 708 mental health boards of Berwyn and Cicero. And they obviously would impact service provision then in the 70s and 80s, but are absolutely still a vital component of our ability to provide services in present day. And this is just kind of a look at what the Community Mental Health Act looked like at the local level. Am I going too fast for you, Anna? Okay, thank you so much. All right, we're about we're a little over halfway. So if anybody needs a stretch break, refill your coffee, this is really where the presentation picks up. I'm very excited to share this part with you. Up until now, right, Berwyn Family Association is kind of really getting its footing. They're adding new services, they're trying to find funding, and things really boom for them starting in the 80s. And we really see what leads to how we look in present day. This picture here is Lauren Fillmore on the right, and in the middle, Carl Bartolucci, who is our executive director at this time. And Lauren Fillmore, we'll talk more about him, had donated funds to open a new building for Berwyn Family Services on Windsor Avenue, 6918 Windsor Avenue. And they called that building with the money that he gave the Fillmore Center. Pretty quickly after that, in the same year, in 1981, the organization, Berwyn Family Services, renames again as the Fillmore Center for Human Services. There's still a lot of people in the Berwyn area who call us the Fillmore Center because they remember this time when this building was around. And we do still have this building. It's open 9 to 5, Monday to Friday. For mental health services, substance use disorder services. We also run a health center out of this location. But now Fillmore Center is one of our locations as opposed to a separate organization, which we'll talk about. So who's Lauren Fillmore? This is him. So Lauren was the son of Lauren and Lucille Fillmore, and Lucille, his mother, owned Lucille Fillmore's dress shop on Windsor Avenue in Berwyn. In addition to becoming the namesake for our legacy organization in one of our buildings, Lauren also founded the Fillmore Day Camp at the PAV YMCA in Berwyn, which still exists today. Lauren also founded the First Baptist Church of Berwyn. He died in 2001 at the age of 80, just a few months after the merger that we'll talk about later, when Fillmore Center kind of goes away and we start to become what looks more like present day pillars. In the 1990s, the agency introduced a Lucille Fillmore Award in his mother's honor. Again, he donated the money to open the Fillmore Center in honor and memory of his mother, Lucille Fillmore. And that award was intended to be given to anyone who was making a large impact on mental health at the time. And one of the early recipients was none other than Mr. Ernie Banks, baseball legend. We'll keep on the baseball theme here because also in the 1980s, Fillmore Center launches the West Suburban Mental Health Softball League. And this on the left is an actual page from their record-keeping books. Many people that we know listed here playing softball for the organization. Fillmore Executive Director Carl Bartolucci was the commissioner. And our team at our organization was called the Fillmore Fire. And they played against other nearby mental health and social service organizations in Berwyn and surrounding communities. It was just so much fun. On the clinical side, Fillmore Center again increases their partnerships, right? So we've already seen them, working with the mental health boards and things like that, and the youth in crisis. In the 80s, they start running outpatient care for clients at River Edge Hospital. They become, for a time, McNeil Hospital's sole psychiatric provider. And they also run a diagnostic facility for mental illness at Hephzibah in Oak Park. Hephzibah still runs, they now run it, but they still have that diagnostic facility today. Fillmore Center also opens 2 more offices in the 1980s, including one in Oak Park that is present-day Thrive, and one in Cicero, which today is a house at Cermak and 58th. And with that expansion, so now they've got Fillmore Center, they've got this Oak Park location and the Cicero location. They're able to move for services beyond just Berwyn limits and start also providing services in Cicero and in Oak Park River Forest. All right, this is just too much fun. So community nurse is operating at this time in LaGrange doing medical and dental care. Berwyn Family Services, now called Fillmore Center, is operating in Berwyn, Cicero. And DVCC is operating out of Summit with their, at the time, their Constance Morris House in Brookfield. And they're basically all using the same logo. And eventually, all these organizations would merge. So it just kind of gives me the goosebumps. Like, did they have any clue that someday these other organizations that looked and felt so much like them are all going to come together? So cool. All right, now I talked a little bit earlier about Fillmore Center becoming known for kind of piloting new things in the area and being such a well-respected provider of psychiatry and psychotherapy services. They also become known across Chicagoland, and we continue to be known today, as the pinnacle placement for quality mental health training. At least a dozen of our former mental health clinical interns are now professors in the Chicago area, training up the next generation of mental health clinicians. Our student training services, like I said, they continue today. We provide quality training in psychotherapy, giving interns an exposure to work in a community-based mental health setting. And this is good for our clinicians too, because they get to hear from the interns about the latest research coming out of our area universities. So it's beneficial on both sides. And I just thought this picture, this is from one of our early staff newsletters. This was a nice quote here from one of our interns from the University of Chicago at the time. Fillmore is the most sought after internship site for students because of its excellent reputation and devotion to both the client and the student. Fillmore is top notch. Okay, it wouldn't be a presentation about the 80s if I didn't mention Oprah. Now, Oprah was not hanging in Berwyn, I'm sorry, but she was hanging with us at DVCC and Summit and in here in Hickory Hills. So in 1983, Oprah attends the DVCC. They're the ones doing Head Start and the domestic violence shelter, right? She attends their fundraiser in 1983. And at the time, she had just moved to Chicago to start her first show, AM Chicago. By 1986, she's a household name. That's the year she got the Oprah Winfrey Show, the year she got the Oscar for The Color Purple, and she comes back that year and hosts an anniversary dinner for DVCC, and that is her with our, at the time, the DVCC Executive Director, Florence Forche. So if anybody knows Oprah, I'm trying to get in touch to make sure she knows that it's our anniversary. All right, we're gonna go to the 90s now. Everybody loves the 90s, right? Fillmore added more new services in the 90s. As I said, the real explosion for this organization happens in the 80s and 90s in terms of an increase in services. But some of the fun stuff, they started a 5K in Berwyn called the Run More for Fillmore. That's Lauren Fillmore on the left. And Mary Stecker, who was the executive director at the time. And they also started a used bookstore called Bound to Entertain, you see on the bottom left in downtown, on Windsor Avenue, close to Fillmore Center. They later renamed that Fillmore Used Books. The bottom right photo on the left is Carl Bartolucci, who was our executive director. And right next to him, second from the left, is Jean Janda, who was in charge of all the volunteers for the bookstore at the time in the 90s. Jean Janda still works with us today. She is in our benefits and administration team. She's probably had every role at the organization. And if you're interested, the Berwyn Development Corporation just put out a video about Jean on their Why Berwyn page just a couple of weeks ago. She's a longtime Berwyn resident and a great member of our staff. So I mentioned earlier, oh, I'm sorry, let me not go to that one. I skipped ahead. Carl Bartolucci. Okay, he's our executive director in the 90s, right? In 1995, Fillmore Center purchases another building in Berwyn at 6415 Stanley Avenue. We're there today. It's basically across the tracks from Windsor Avenue in the Depot District, on east toward the police station. And that same year that they purchased this building, while Carl Bartolucci is in the executive director's seat at the organization, he dies. And so they pretty quickly rename the Stanley Avenue building the Carl Bartolucci Center, or as we call it, CBC. And it is still called the Carl Bartolucci Center today. Today, that is where we run our behavioral health crisis services. So at this time in the organization, Fillmore Center has the Fillmore Center on Windsor, the Carl Bartolucci Center on Stanley, the location in Cicero, that's a house today, and the location in Oak Park that's present day Thrive. Okay, and here is on the top right is Carl Bartolucci's family at the opening of the Carl Bartolucci Center. And on the bottom left, we see second from right, Lauren Fillmore, joined by the Berwyn mayor at the time on the right for the opening of the Carl Bartolucci building. Sexual assault services are also expanded in the 1990s. So now DVCC has their domestic violence shelter, Constance Morris House. And I'm stepping away from Berwyn for a second. DVCC then opens a sexual assault victim services office on Cermak in Cicero in 1997. Today, it's a private home at Central and Cermak. And this is the start of what our present day sexual assault services look like. Today, we have a 24-hour hotline. We have 708-482-9600. We have medical advocacy for victims at local hospitals. We have we do courthouse advocacy, accompanying them to the courthouses, and so on. In the late 1990s, the reason I'm mentioning all these other organizations is because the mergers are about to happen. A merger's brewing in 1997 between Fillmore Center in Berwyn and Community Family Services in the LaGrange area. And they start talking like, we're not quite ready to merge, but like, it would be really nice to, use to grow our resources jointly in the back of house. So by July 1st, 1998, they passed a formal affiliation, and Mary Stecker from Community Family Services becomes the CEO of both organizations. They're operating separately, but with one CEO, Mary Stecker, and then starting to hold things together like they do a joint fundraiser instead of holding two fundraisers separately. Helen made the slideshow. This is my boss, Helen Stewart, in the 1990s. Fillmore Center receives a grant in 1999 to be the lead mental health agency for something called the Safe Schools Healthy Students Initiative. And Anna, I believe you were involved in this as well, right? Yep, I see your name here actually. So the grant tasked the Fillmore Center with developing programming for kids who came from high-risk families in Berwyn and Cicero. And there was really no guidance as to how they should carry this out, just that they should find a way to address children's needs from these high-risk families. And the way that Fillmore Center decides to address it is with the introduction of home-based therapy. At the time, people were not doing home-based therapy, and there was certainly a reaction from traditional psychotherapists who felt like therapy should be done in the office only. Today, home-based therapy is much more standard across Illinois and across the country, in addition to office-based therapy. Now, this is in here really because our school-based partnerships have always been an important component of the organization. In fact, Community Nurse in LaGrange back in 1921 had installed dental chairs at local schools. So we've always really had school partnerships as part of our organization. Today, we continue to partner with Berwyn. We have mental health services co-located at D100 schools, and we're also at Riverside Brookfield High School and at St. Mary's of Riverside, among others. Okay, stick with me. This is the toughest part to get through because it's so confusing. So there was this formal affiliation happening, right, in the late 90s between Community Family Services in LaGrange and Fillmore Center in Berwyn, and they're under Mary Stecker, right? They formally merge in 2002, and they give themselves a new name, Community Care Options, on the right. At that time in 2002, the Fillmore bookstore remains open. Mergers can be tough in terms of when things open and close, but Fillmore Center made it and remained open. However, they closed ILC Enterprises, that client-run business, at the merger in 2002 when they became Community Care Options. And because they closed ILC Enterprises, which was operating out of the Carl Bartolucci Center, that building on Stanley Avenue sat empty for a few years. Eventually, our crisis team would move out of Oak Park into the Carl Bartolucci Center, and they remain there today. Okay, so that's Fillmore Center merging into Community Care Options. On the left, Des Plaines Valley Community Center, that has the domestic and sexual violence services, changes its name. So what happens is they have this designer who's supposed to create a new DVCC logo for them, but she keeps using this phrase, "You guys are like the pillars of the community." And they like it. So they name their staff newsletter The Pillar. And pretty quickly, they just changed their whole name from DVCC to the Pillars Community Services. Now, there's more reason for that than what I just said. And if you read the booklet next week, you'll understand. A lot of name changes happening here, right? So Fillmore Center is now part of Community Care Options. DVCC is now the Pillars Community Services. 4 years later, in 2006, these two organizations merged to become Pillars. And from 2006 until 2018, of everybody I've mentioned, the only two players left in the game are Pillars, which is the merger of all these organizations, and Community Nurse in LaGrange that's doing medical and dental. This is geographically how we start to look like we do today. So you get, from Community Care Options, you've got the Fillmore Center, the Carl Bartolucci Center. From the Pillars, which used to be DVCC, you get our domestic violence shelter, our sexual violence services, our Hickory Hills location. So we become a lot more geographically spread out, which is how we continue to be today. Okay, let's get a little closer to today. In 2009, the Community Healthcare Network of the Western Suburbs springs up. Now, this is led by Community Nurse. Our present day CEO, Angela Curran, is third from left, wearing the purple in this photo. At the time, Pillars was led by Ann Schreiner, who is second from left in this photo. The Community Healthcare Network is basically, this still exists today. You can get a network card if you are a uninsured or low income or medically underserved adult. You get a network card, and then you have access to this array of coordinated services across the western suburbs. And this includes coordinated care at what was community nurse, today our health center. You get access to mental health care from Pillars, things like discounted prescriptions, access to free lab services at LabCorp. This all still exists today. But the point of this is that you see suddenly Pillars and community nurse that over the years have maybe referred to each other for services, getting a lot closer together in terms of a more formal partnership. And around this time also, Pillars begins co-locating at community nurse in LaGrange and has a behavioral health office on Calendar Avenue at community nurse. A couple years later in 2012, community nurse becomes a federally qualified health center. And what that means is now instead of operating as a free clinic that's operating based solely on charitable contributions, they're getting money reimbursed from the federal government to provide these services, which ensures more access to care for people who need it in the area. Pretty quickly, Pillars and community nurse decide to join forces. So by 2017, the discussions are happening. And by January 1st, 2018, we're formally merged. So all these organizations I've been talking about for 45 minutes all come together on January 1st, 2018, when Pillars that used to have Fillmore Center and Des Plaines Valley Community Center and CFS merges with community nurse that had medical and dental. Now under one roof, you've got medical and dental mixed with mental health and social services. So there really is an attention to the whole health of the person and the community. At this time, we talked about the Fillmore Center. You know, Fillmore Used Books made it through the 2002 merger. They closed at the 2006 merger. Similar things happened soon after we become Pillars Community Health. We discontinued our Head Start grant in 2020. That is now being overseen by Easter Seals and Elva Lore, who are going to be using our space in Hickory Hills to offer that programming. And in 2020, we closed our resale shop in LaGrange, which we had had since 1921. Brick and mortar store that was already, you know, retail and brick and mortar has already been struggling. And then when you add the pandemic, it exacerbated the situation and we were had to make the decision to close it. I mentioned earlier, you know, you see these organizations shifting to meet the need. We saw it at Berwyn Family Services in the 1950s when they say, okay, welfare work isn't really what's needed anymore. It's mental health. We continue to address this today. We're constantly assessing what the community's needs are and shifting to meet those needs. So in 2020, we opened 3 testing sites. Just recently, about a month ago, we opened a vaccine clinic for the COVID-19 vaccine in LaGrange. Our health center team is doing things like curbside visits for diabetes checks. All of our other programs are operating virtually, some of them in person, depending on the need of the client, but all of our mental health services continue to operate virtually. Our domestic violence shelter remains open amid the pandemic. All of our domestic and sexual violence services are still available. And our outreach teams are even doing virtual presentations at D100 schools and holding virtual groups with the students today. So when you think about kind of where we came from the Spanish flu epidemic right up until the COVID-19 pandemic, it has been quite a storied history. And again, I've just spent an hour really only talking about Berwyn with a little mix of Summit and LaGrange. There is so much more information beyond what I've shared with you. And so again, look forward to an email from me next week with a link to our full history. And you can always go to our YouTube account, Pillars Community 1, to watch the LaGrange presentation that we held the other night. So now I'm going to stop screen sharing for a moment, and I'm going to pull up our very own Catherine Banashock. She is our VP of Philanthropy. Hi, Catherine.
Hi.
And Catherine is going to talk a little bit about ways to get involved if you are interested in doing so. So Catherine, thank you for being here. I'm going to go ahead and share my screen for you.
Thanks. Okay. Awesome. Thank you so much, Jackie. And just again, so incredible to hear the transition that our organization has made throughout the year and or throughout the years, I should say, the century, and just the impact that Berwyn has had on what we offer today. So we've asked ourselves whether it is appropriate to celebrate this milestone while so many are suffering from COVID-19. So many have endured family loss and severe economic consequences, and racial and cultural disparities are so devastatingly impacting those we serve. But as our CEO, Angela Curran, says, all this turbulence just makes it more important to celebrate a 100-year commitment to looking after our neighbors, regardless of race, income, or politics. This really is a celebration of community. And we hope that you'll see the role your community, Berwyn, has played in all of us, and that all of us here play in stewarding this historic organization into the future. We're so proud to commemorate our 100th anniversary this year, marking 100 years of service to our community through transformative whole person care. Despite the challenges that each of us may face, when we come together to provide individuals the opportunity and access that they deserve, positive change is possible for each and every person. It is our constant goal to realize this vision of giving all people access to care, and we're grateful and excited that you have chosen to be a part of our century-long mission in doing so. So a couple ways, if you'd like to get involved with Pillars Community Health, you can volunteer. We do offer a few trainings for our volunteer services through domestic violence and sexual assault hotlines, or through Buddy's Place, which is our childhood bereavement program, as a group facilitator or a greeter. You can come work with us. We continue to hire throughout the pandemic. We post job updates and postings regularly on our website with descriptions. You can also make a donation in support of our services by visiting the website Jackie has listed here, pillarscommunityhealth.org/donate. A gift to Pillars Community Health serves as an inspiring testament to one person's ability to bolster their entire community. We would not be the organization we are today or be able to offer the services we do without generous donations from our community. And we're so grateful that communities like Berwyn have been so supportive throughout the years, throughout the century, and continue to allow us to provide services to our friends and neighbors right here. So thank you for the incredible role you are playing in your community by being here, by learning about our history and Berwyn. Thank you so much for your belief in our mission. Again, we would not be able to do what we do without your help. So thank you.
Thanks, Catherine. All right, well, that concludes our presentation. However, I will remain on for a few minutes if anybody wants to ask questions or make comments in the chat. I did see some comments from June and Diane and Robert. I'm thinking that's you, Bob Webb. So thank you guys for being here today, and thank you for your kind words. Diane says, fascinating local history, much of which I actually remember, which is great to hear. So thank you. We'll stay on, play some 1920s music for a couple of minutes. And I hope all of you get to get out and enjoy a little bit of this beautiful day and gorgeous sunshine. And thank you, Anna, so much for translating. I see Pat Seegers is with us. Thank you so much for coming, Pat. That makes my whole day. Oh, Bob, Robert, I will post the link in the chat, but we'll also email this out. Thank you, Pat. Thanks, Charmaine. Glad you guys could join us today. Pat, I hope you got to see your baseball team. It's the best. And thank you again to Lisa and the Berwyn Historical Society for co-hosting this with us. Yes, Pat, it is recorded. I will upload to YouTube and send that link out next week. And I will make sure you're on that because I think we may have to get your email address here. Yes, and Anna, who's been translating for us, said Pat Seeger's hired her and Helen Stewart that was in the Safe Schools initiative that we watched earlier. So thank you, Pat. Best decision ever made. So cute. Okay, we'll give it about 1 more minute before we log off. If anybody has any questions or comments. All right. Thank you, Lisa and Anna. Have a great day. I'm going to go ahead and stop the share. Take care, everybody. Thanks, Catherine.